Recording in progress.
Okay. Assalamualaikum and good morning, everyone. Okay, this lecture will be related to gross anatomy of kidney, ureter, urinary bladder, and urethra. Okay, well, before we start about all the components in the urinary system, there are basically can be divided into upper urinary tract and lower urinary tract. Okay, the upper urinary tract consists of the kidney and the ureter, or the lower urinary tract is from bladder until urethra. Okay. Okay, another picture showing the same thing. Actually, the upper and the lower urinary tract. Okay, the upper urinary tract is from the urinary, sorry, the renal, the kidney, all the structure in the kidney, and the ureter, or the urinary bladder and urethra is categorized into the lower urinary tract. Okay, let's know in general about the anatomical feature of position of the kidneys. Okay, you must know this, that there are retroperitoneal organ. They are retroperitoneal organ, okay, and they lie on paravertebral gutter. So this is the paravertebral gutter. Is the vertebral. The para means each side of the vertebra, and location is located at the level of thoracic 12, T means thoracic 12, extend up until lower down until the lumbar fold. Okay. Each kidney is slanted medially. It's slanted medially. You can see that the kidney is actually a little bit slanted medially at its upper pole, as its long axis is parallel with the lateral border of the psoas major muscle. You can see this is the psoas major muscle. Okay, this one, psoas major. This is so because of the position of the psoas major muscles, the kidney is situated slanted medially. In fact, the second fact that you have to know is that the right kidney, you can see the right kidney placed slightly lower than the left kidney. Okay, this is the surface anatomy of the kidney. Where is the location of the kidney? When you examine, where can you search for the kidney? Okay, it's actually at the level of the pyloric. Okay, pyloric is the one part of the stomach. Okay, so when you make a plane, one imaginary line passing through the transpyloric, the pyloric, so pyloric region of the stomach, that line is called transpyloric plane. And the kidney is located to this plane. It's different from the right kidney and the left kidney. It's located differently to the transpyloric plane. You can identify that. You can see that. See in this picture. Okay, the right renal hilum is actually that is related to the transpyloric plane at its superior part of the hilum. Okay, before we begin, okay, this is kidney and this is the hilum. Hilum of the kidney is the Hilum means where the structure goes in and coming out from the kidney. So this is the region called the hilum. Okay, okay, this is the kidney. Okay, this is the hilum. Let me show you from the previous slide. Okay, this is the hilum. Okay, this is the hilum of the kidney. Okay, transpyloric gland is actually passing through this. Okay, to this imaginary line. Okay, it is related to the plant is related to the upper part of the renal kidney hilum, right renal hilum, and while for the left renal, it is related to the superior part of its hilum. I think you know why, because right kidney is located slightly lower than the left kidney. Okay, and then we go to the posteriorly. Posteriorly, the right kidney can be cat, okay, and it's related to the T12 and T11. For the left kidney, for the right kidney is related to the T12, because again, the location or the location of right kidney is slightly lower than the left kidney. Okay, let's go to the kidney structure, the gross structure of the kidney. Okay, it is an organ that is ovoid in shape. Okay, or many books say it is bean shaped organ. Kacang panggang, right? Okay, it is reddish brown in color. The dimension is well, you have to know, but I just want to explain. Okay, this is the length is about 10 centimeter. The width is 5 centimeter, and the thickness is about 3 centimeter. Okay, this is the kidney. This can be right. This can be left kidney. All right. So this is the hilum of the kidney, and you can see this is the fibrous capsule that cover a very tough capsule that cover the kidney. All right. The kidney this is the fact that you have to know. Okay, kidney is best described. Gross anatomy of kidney. It has surfaces, margins, and poles. You have to know this. Where is the two surfaces of the kidney? And where are two margins of the kidney? And where are two poles of the kidney? Okay, let's talk about the surfaces. Each kidney contains anterior and posterior surfaces. Okay, obviously. Okay, anterior and posterior surfaces. Right. And it has two margins, the lateral margin and the medial margin, where the hilum of the kidney is located at medial margin. And it has two poles, the superior pole and inferior pole. All right. And now we go to the covering. What covers the kidney? The kidney. Okay. Yeah, this is all the renal covering. Okay, from the innermost. The innermost is the fibrous capsule. Okay, this fibrous capsule is a very tough connective tissue. It's really attached to the tissue of the kidney. We cannot remove it easily. And then second layer is the perirenal fat. The perirenal fat. The perirenal fat. The renal fascia. This is the renal fascia. And the pararenal fat is outside. The perirenal fat, the ureter fascia, and pararenal fats covering entire structure which include the kidney or the renal and the suprarenal gland on top of each kidney. So only one structure that is just completely only covering the kidney, which is the fibrous capsule. Yang lain semua cover dua-dua. Right? Understand? What is the function of the renal covering? This provides some protection from trauma and damage and put kidney in its position. Okay, this is again some picture showing the renal covering. You have the renal capsule, okay, renal capsule. And then the perinephric, and then the renal fascia or gyrus fascia, and the most outer is the paranephric. Okay. Let's go one by one. Okay, the renal covering. The first one is the fibrous capsule. It's a tough fibrous layer surrounding the kidney. It consists of dense, irregular connective tissue. So, fibrous capsule, dense, irregular connective tissue. Fibrous capsule, dense, irregular connective tissue. And then outside from the fibrous capsule, there is perirenal or perinephric fat, usually lies outside the renal capsule, and of course, it plays part in retaining the kidney in its position. Now, nephroptosis or floating kidney is a condition when a person experience severe weight loss, when there is no more perirenal fat support, the renal become floating. Then nephroptosis. Okay, these are all the symptoms of the nephroptosis. That person might experience a sharp side pain, nausea, vomiting, hypertension, and abdominal mass when standing upright. So because they can actually feel that the kidney is moving. A weighing feeling in the abdomen, that's berat. Okay, hematuria, blood in the urine because of the movement of the kidney, and proteinuria, excessive protein in the urine. Okay, that fact is just a nice way to know. Okay, and now we go to the renal fascia. Okay, the renal fascia in this picture, very clear. Renal fascia, also known as gyrus fascia. Okay, it has anterior and posterior layers of the renal fascia. It's made of collagen, fibrous connective tissue, and it's encapsulated both the kidney, the renal, and the adrenal gland or the suprarenal gland on top of the kidney. And gyrus fascia separates perinephric fat from the paranephric fat. Para outside, the fat outside the renal fascia. The pararenal or paranephric fat, okay, the outermost covering collection of adipose tissue located superficial to renal fascia. And these are all some of the relation of the right and the left kidney. This is posterior relation. Okay, for anterior relation, there are so many structures like stomach, duodenum, the large and small intestine. And for you, I just want you to memorize the posterior relation of the right kidney for the right and left kidney. Okay, for the left kidney, as I mentioned in the previous slide, it is related to the 11 and 12 ribs. While for the left kidney, it just related to the 12 rib because of the slightly lower location of the right kidney. And there are also muscles that is located posterior to the kidney. D is diaphragm, PM is psoas major, and then there is quadratus lumborum, and the transversus abdominis. These are all the muscle of the posterior abdomen. All right, this is the same as the previous slide. Okay, now we move on to the kidney internal structures. Okay, kidney internal structures. Okay. Kita koyak sikit this kidney. This is the renal hilum, as all of you know, where the structure coming in and coming out from the kidney. Okay, and then this is the renal sinus. Renal sinus means cavity, the cavity within the kidney. It's occupied by the renal pelvis, the renal calyces, blood vessel, nerves, and fat. Actually, most of them are occupied with fats and other tissue. Renal sinus. And then the renal pelvis, this is the renal pelvis. The funnel-shaped chamber occupies most of the renal sinus, connected to the ureter inferiorly. So the renal pelvis is connected to the ureter inferiorly. Okay, and then there is major calyx, major calyces, 1, 2, 3 major calyces. These major calyces merge into a large renal pelvis. And then each major calyx has many calyces, minor calyces, 4 or 5 minor calyces that merge into the major calyx. And renal papilla, okay, the renal papilla. So this is the renal papilla. It is tip of medullary pyramid, side of where urine is excreted to a cup called the minor calyx. Okay, from the urine flow is from the tips of this urine medullary pyramids, goes into the minor calyx, to the major calyx, minor calyx, major calyx, to the renal pelvis, and eventually to the ureter, bladder, and urethra. We have to know the internal structure of the kidney. The renal hilum. Okay, this is the renal hilum. It's the middle border of a kidney. It transmits vessels, nerve, and ureter from anterior to posterior. Okay, the location, what are the structure? Is anterior. The anterior most is the renal vein. So the renal vein, anterior, and then the renal artery, and the posterior most is the renal pelvis. Why do you need to know this arrangement? Because when you are given a specimen of kidney, you can check if the ureter is in this specimen. When we focus on this specimen, so the ureter is located posterior, and then artery in the middle and vein is anterior. So that means this is the right or the left kidney. So this is the right kidney because of the arrangement of the structure that passing in and out of the renal hilum. Okay. The kidney internal structures consists of one renal lobe. See, this is one renal lobe where it made of one pyramid and cortical tissue surrounding the pyramid. So this is the pyramid or the medulla, the cortex, and this is the medulla. There are 5 to 11 lobes in each kidney. Okay, the renal parenchyme means tissue of the renal. It can be divided into renal medulla and renal cortex. Renal medulla, this one, and renal cortex, this one. Okay, right. Medulla, renal cortex. Renal parenchyme, the renal medulla first. Okay, renal medulla is also known as renal pyramid. Okay, the renal papilla, the tips or pegs of the pyramid, this one, as I mentioned before, projects into minor calyx, opening for collecting dark of urine. Between two pyramids, okay, between these two pyramids, between two medulla, there is extension of the renal cortex known as renal column. So this is the renal cortex, the renal cortex, the renal column part of the renal cortex, and this is the renal medulla or renal pyramid, and the apex or the tips of the renal medulla is known as the renal papilla. All right. Now go to the renal cortex. The renal cortex is below the capsule, immediately below the capsule. It's lighter in color as compared to the renal pelvis. Renal pyramid, arching over the base of pyramids, extend between the renal pyramid and renal column. Right, and then the renal cortex contains the renal corpuscle. So renal corpuscles, the distal and proximal. This is proximal and distal convoluted tubule, while the renal medulla contains straight collecting tubule. Okay. The blood supply to the kidney. Okay. It's supplied mainly by the right and left renal arteries. So obviously, right renal artery supply the right kidney, while the left renal artery supply the kidney. Each artery divides into 5 segmental arteries, 4 anterior segmental arteries, and 1 posterior segmental artery. What are all those segment? Superior segment, anterior superior, so superior, anterior superior, anterior inferior, inferior, and then it's posterior. Sorry for the misarrangement of this. Segmental arteries are in arteries. They do not anastomose significantly. The area supplied by each segmental artery is an independent surgically resectable unit of venous segment. So if someone with any condition that need resection, they can entirely remove the area that is supplied by one segmental artery, one renal segmental artery. Okay. All right, these are all the regions that supply by different segmental artery or segmental branches of the renal artery. So apical, anterior superior, anterior inferior, and basilar. Or this one is also called superior, inferior, anterior superior, anterior inferior, and posterior part. So the renal blood flow, since blood passes through 2 sets of capillaries, glomerulus, peritubular capillaries, passes it from the renal portal system and arterial portal system. So let's which flow is the blood flow of the urinary system? Is from the renal artery, blood coming out from the renal artery goes to segmental artery, interlobar goes to interlobar, and then arcuate artery. From the arcuate artery, branching out to the interlobular artery. This is the interlobular artery that gives off the afferent arteriole that form part of the glomerulus. This is the renal corpuscle, the part that filtering urine. So I think you will learn this more in the histology of the renal, okay. So the afferent arteriole is coming out from the interlobular artery. And from the glomerulus, it goes to efferent arteriole, and for further absorption of all the needed water or nutrient from the blood that has been filtered through glomerulus, and eventually it's returned back to the interlobular vein, arcuate vein, interlobar vein, and interlobar vein and renal vein. Some books mention there is no segmental vein, but some books mention there is segmental vein. So, well, if you say there is segmental vein, this is true. When you say there is no segmental vein, it's also true, right? Okay, this is how the renal blood flow look like. Unfiltered blood in. Okay, in the renal artery, so left or right, goes to segmental artery. How many segments do we have? 5 segmental arteries, 4 anterior and 1 posterior. Okay, and then from the segmental arteries to the interlobar. Interlobar to arcuate, and from arcuate to the interlobular, and from interlobular to the glomerulus, and back to the interlobular veins, arcuate veins, and then interlobar and left renal vein. Okay. Venous drainage is by the renal vein. Renal vein and then into the this. Okay. Interlobular to the arcuate vein, to the interlobar, to the segmental veins, to the renal vein, and eventually to the IVC. Just an important notes to you, for you to know that the left renal veins is slightly longer than the right renal vein, because when you see the arrangement of this structure in the abdomen, you can see this is IVC, this is inferior vena cava, and this is the abdominal aorta. So one way of reaching out the left kidney, it has to be longer than the left renal vein. Okay, receive the left, for the left renal vein also receive the left suprarenal gland from the adrenal gland. Okay, so this one, and also left receive the blood return from the left gonadal vein. Okay, right. While for the left or to the right renal vein, it's shorter and it doesn't receive any blood returns from the suprarenal and the gonadal vein. All right. Okay. Another picture showing the longer left kidney. Now we go to the second part, which is the ureter. Ureter. So this is the ureter. It is muscular duct. It's located retroperitoneally. It's like the renal, and the length is about 25 to 30 centimeter, and the diameter is 3 millimeter. Okay. Okay, this part you have to know. There are three parts of the ureter. One is abdominal part, and pelvic part, and intravesical part. What is abdomen? Okay, this is abdomen. So, abdomen is part of the ureter that is located in the abdomen. Once it enters the pelvic, so this is the pelvic region, it becomes the pelvic part, and intravesical is part of the ureter that's embedded in the wall of the bladder. Vesical means bladder, so intravesical, intravesical part. Okay, this is how it looks. Okay, ureter, and this is the opening of the ureter. There are few sites of constriction in the ureter, where this site of constriction are potential site for obstruction for renal kidney stones. Obstruction by renal calculus causes acute distension and severe pain. It's really painful. So where are all the constriction? First is the constriction at kidney hilum, so the junction between the ureter and the renal pelvis. Second is the constriction at the pelvic brim. Remember the ureter will enter the pelvic cavity, and this is where the second constriction is located at. And thirdly is the constriction at the bladder entrance. Remember, there is the intravesical part, so there is also one possible site for kidney stone to lodge. Okay, now this is a really important relation of in female near the ischial spine. The ureter turns downward, forward, and medially, just inferior to the uterine artery, the uterine vessels. So many cases involve the uterus, where the doctor need to cut the uterine artery, with accidentally cutting off the ureter. So the ureter in female is endangered in hysterectomy. So after the hysterectomy operation regarding related to the uterine artery, the doctor must make sure that there is urine flow, urine coming out from the patient. Okay, ureter blood supply, upper, middle, and pelvic part. Upper part is supplied by the branches of the renal artery. They also may receive branches from the gonadal and colic artery, and branches from the middle abdominal aorta supply the middle part, and branches from the vesical, middle rectal, and uterine artery supply the pelvic part. The location. Now we move on to the location of the bladder. Sorry, the bladder. The bladder is located in the pelvic cavity. Although it is entirely situated in the pelvic cavity, when empty, it may expand superiorly into the abdomen when it is full. Okay, what is the function of the bladder? You have to know this. It is temporary storage for urine. So temporary, just temporary. So it's accommodate to 400 to 600 ml of urine in healthy adults. It assists in the expulsion of urine, where you can see in the wall of the bladder, there is the muscle. This is not the dorsal muscle, which contract during maturation. Okay. The bladder parts, you have to notice there are 4 bladder parts. This is apex. Okay, can you imagine this picture? Okay, this is base, this is base, this is apex. Okay, this is inferior surface, the neck of bladder down here. Apex of bladder is directed towards the top of pubic symphysis. Median umbilical ligament is continuation of apex. Okay. And then you have the base. This is the base. The base of the bladder is shaped like an inverted triangle. The 2 ureters enter the bladder at each of the upper corner of the base. Okay. And the urethra drains inferiorly from the lower corner of the base. And the neck of the bladder surrounds the origin of the urethra at the point where 2 inferior lateral surfaces and the base intersect. And inferior lateral surfaces of the bladder cradle between the levator ani muscles or the pelvic diaphragm and the adjacent actuator muscles. This muscle are all the muscle of the pelvic region, of the pelvic floor. Okay. The neck of the urinary bladder is the most inferior part of the bladder. The most fixed part of the bladder is anchored into position by a pair of tough fibromuscular band. Okay, this fibromuscular band. The next, this neck of the bladder becomes very fixed. Okay, the fibromuscular bands in female is known as pubovesical ligament. Pubo mean pubic, vesical mean bladder. Pubovesical ligament. While in male, it is known as puboprostatic ligament. Remember, below the neck, there is prostate gland in male, and that is why we call the fibromuscular band that anchoring the neck of the bladder is known as puboprostatic ligament. Now, the last part is the urethra. Urethra begins at the base of the bladder, okay, and end at the external opening in the perineum. So this is female. So female urethra is really short, 4 centimeters. That's why urinary tract infection is really common in female, okay, especially in pregnant mother. The urethra in female passing through deep perineal pouch, okay, this one, and open at between the labia minora. While for female, the urethra is really long, okay, it's about 20 centimeters. So if UTI, urinary tract infection, happen in male, the doctor must examine thoroughly the causes of the UTI in male. Okay, for male, it passing through the prostate, the deep perineal pouch. Okay, and then perineal membrane, and enters in the root of the penis. Okay, I think that's all about the renal with ureter, bladder, and urethra. Okay, I will talk some about clinical notes. What is the most common clinical thing happen in renal system is the renal stone. It's also known as kidney stone or nephrolithiasis. Minerals in urine form crystals or stone which may grow large enough to block urine flow. Most kidney stones pass on their own, but some are too large and need to be treated. Lithotripsy is one of the procedure that can shatter the kidney stone into small pieces, so that the small pieces that's broken up by this lithotripsy can pass in the urine. Lithotripsy is usually done by a machine that projects ultrasound shock waves through the body. Okay, these are all different kinds of kidney stone. Okay, this is how they do the lithotripsy. Ultrasound shock wave hopefully can break the bigger kidney stone, so the smaller kidney stone may pass easily through the passage of the urinary tract. And then ureteric colic is related to the renal stone. Okay? Renal calcified stone may be found anywhere between the renal calyces and urinary bladder. A stone in the ureter can cause significant distension. This results in colicky pain, usually radiating from the loin to groin as ureteric contraction try to move the stone distally. Depending on the level of obstruction, the ureteric colic may also be referred to the lumbar or hypoplastic region or to the external genitalia. Ureteric colic is considered as one of the most painful conditions. And this is how the referred pain looks like. Okay, it is known as renal colic, pain due to ureteric stone, which causes spasm of the ureter, start at loin and radiate to groin. This is loin and radiate to groin. The scrotum, the labia major and inner side of the thigh. I think that's all, and thank you for watching this audio lecture, and I wish you all the best. If you have any question, you can always email me. Thank you so much. Bye bye.